In recent weeks, confusion has spread across England over who exactly can get a COVID booster shot. Pharmacies have found themselves at the center of frustration, with patients arriving for appointments only to be told they are no longer eligible. This issue has sparked debates about communication, fairness, and the future of COVID vaccine eligibility in the UK. The confusion began after new guidance from the Joint Committee on Vaccination and Immunization, or JCVI. Their updated recommendation limits who qualifies for free COVID booster jabs under the NHS. Previously, a much larger group of people could get the vaccine, including many younger adults and those with mild health conditions. Now, the eligibility criteria are tighter, focusing mainly on older adults, people in care homes, frontline health workers, and those with serious underlying health conditions. The goal, according to officials, is to focus resources on those most at risk. But the way the change has been rolled out has caused real problems on the ground. Many people booked appointments through their local pharmacy, believing they were still eligible. They received confirmations, made plans, and showed up, only to be turned away. For pharmacists, this has been especially tough. They are the face of the program for many people, yet they had little control over the rule changes. Some pharmacists have reported being shouted at or blamed by upset patients, even though the eligibility decisions come from the NHS and the JCVI. One pharmacist said the situation feels unfair to both staff and the public, because the system isn't clearly communicating the changes. So why were the rules changed? The JCVI's reasoning is based on current data about immunity and risk. Most healthy adults under a certain age now have strong, long-lasting protection, either from previous vaccinations, past infection, or both, with COVID hospitalizations lower than in earlier years. The committee believes booster doses should be reserved for those most likely to get seriously ill. However, not everyone agrees with this approach. Critics argue that limiting free vaccines could create inequality, where people who can afford to pay privately get boosters, while others go without. Some also worry that confusion and reduced access might discourage people from getting vaccinated in the future, even if they become eligible again. There is also concern about communication. Many feel that the NHS should have done more to clearly explain the updated COVID vaccine eligibility rules before allowing people to book appointments. Several patients have taken to social media to share their frustration, saying they felt embarrassed or angry after being turned away. Others expressed disappointment, saying they were simply trying to protect themselves and others. Pharmacies are caught in the middle of all this. They are responsible for delivering the service, but the criteria and booking systems are controlled by larger organizations. Some pharmacists have said they weren't even told about the changes until after appointments were already booked. That's led to a wave of cancellations and complaints that could have been avoided with clearer information. From the government's perspective, this is about efficiency and evidence-based policy. They want to ensure that limited supplies and staff time are used to the groups who benefit most from an extra dose. But for the public, it feels like the rules keep changing, and that trust is being stretched thin. The broader question is what this means for the future of COVID vaccination in England. As COVID shifts from being an emergency to something managed more like seasonal flu, vaccine eligibility will likely keep evolving. Over time, boosters may be offered mainly to high-risk groups each autumn, similar to how the annual flu jab works. But that transition needs to be handled carefully. Communication must be clear, fair, and transparent if public confidence is to be maintained. For now, the key message is simple but important. Before booking a COVID jab, check the current NHS guidance to see if you're eligible. Eligibility rules can change, and different areas may have slightly different availability. If you're not sure, ask your pharmacy or GP before making an appointment. The story unfolding in England highlights how something as simple as a booking system can expose the cracks between policy, communication, and public expectation. The confusion around COVID vaccine eligibility shows that even small gaps in information can lead to big frustration. As the country continues to adjust to a post-pandemic world, the challenge will be keeping the public informed, supported, and confident that the system is working for everyone. Because in the end, vaccines only work when people trust the process behind them.